Ojeda.
Hi Rohi, how are you?
I'm good. How are you?
Good, doing great here.
Okay. I welcome you to lovehealscancer and ZenOnco.io. I am Arohi from ZenOnco.io. This is our cancer healing journey talks, where we invite speakers who have gone through cancer, either as patients or as survivors or as caregivers. These stages are really close to our heart because many patients have told us that when we listen to other people's journey, it inspires them and it boosts their confidence and it gives them hope that if other people have overcome cancer, so can they. So thank you very much for being a part of today's CHA talk. And let's begin by a brief introduction of you, and then you can tell us how it all began. What were the initial symptoms which prompted you to go to the doctor for a diagnosis?
Yes. Well, thank you Rohi for giving me ZenOnco.io for this
Yeah.
opportunity to share my story. As a cancer survivor, for me, talking about it at the very beginning was very difficult. I need to say. Since I was a child, because I was diagnosed with cancer when I was a child, the first time I am a leukemia survivor. I had acute myeloid leukemia. I was diagnosed the first time when I was 8 years old, and the second time when I was 15 years old. And for me, to be able, as I was mentioning, to speak about it as a fact, and those events are like factual moments in my life, have been quite a journey, because I have been working with psychologists, with coaches, that has helped me to release all the feelings that came with surpassing that illness. It was not easy for me. The first time when I was diagnosed, I was 8 years old.
Yeah.
And when everything started, I just remember that I was at school, and I started to feel, it was quite quickly, honestly. I remember that I was feeling like very weak. I started to be dizzy. When I was like in big crowds. I study in a non-school, so usually when we went to mass, I used to always get like a little bit like feeling funny, and I used to just like fall. I remember that I just fall, and they called my mom, and she came to pick me up at school, and then they just measure my temperature. I had high temperature, but before those days, I started to say to my mom that I was feeling a bit weak, and so she got it, and right away she took me to the doctor. And before taking me to the pediatrician, she took me to have a blood test, so the pediatrician could have like a complete overall. But she took that decision on her own, based on how I was feeling and the high temperature. And then finally, I remember that remembering all this have been difficult, as I said.
Yeah.
But I have been working, I have been writing about these memories to be able to bring those memories back. And I remember, and I spoke with my mom to kind of being sure that that happened. And what I get to remember is that after they got the results, they asked my mom to redo the test, because they found something strange. So when they redo the test, I just remember that day that I was feeling very sick at the hall where I was waiting for the results. And right away they said she needs to go to a special doctor. I do not remember very well, but it was those tests were taken in the morning, and in the afternoon, early afternoon, I was in another in a new doctor. It was not my pediatrician. And I remember that the first time that I saw the name of that doctor, it was difficult for me even to pronounce it. Hemato-oncologist. I was like, what is that? And well, that day, right away after the appointment, I remember that my dad also arrived. And as I mentioned, I was feeling weaker and weaker,
By the hour?
Yeah. And then they said she needs to stay at the hospital. And since that day, I entered hospitalization, and the treatment already started. And now that I have been able to read more about how leukemia happens, I just understood that leukemia goes very fast, and the type of leukemia that actually I had, it's the one that it's like goes like really into the blood system. One can get very, I don't have like the proper terms, but can act really fast. I also know that leukemia is one of the most common illnesses,
right, it is.
cancer illnesses in kids, in young kids. So, but all these things I have been able to recognize it like
years
very
later.
recently. And well, that treatment involved back then, for me to stay at the hospital for 1 month.
Right.
And I just remember that it was very hard because I was like pinch every day, and then they decided when I had at the very beginning of my stay at the hospital to put a catheterism for me, like not to be big all day. And then the treatment started, and I just started also to feel really bad. It made me feel really bad. My hair started to fail. First they got it like short, and I just remember, and this was a very difficult image for me to talk about it, and I might get a little bit emotional. The first time that I saw myself with the short hair, it was very hard.
And as a kid, understanding all those things happening to oneself, it's really difficult.
It's really difficult. I love to tell, because now that I am like a wellness coach, and I get to support people that have gone through similar experiences. One of the things that I always tell, I always get to tell this story because for me it helped me to process and to understand a little bit what was happening, because for a little kid to understand what is cancer, it's
what's happening to my body? Why am I feeling so weak? Why can't I go out and play?
It was completely a mess, for me, even to understood what type of doctors were visiting me. And they came like 5 doctors like every day, just to see how I was doing. And I just remember that a person came and he just did kind of a healing meditation, to support my energy. That's what I understood that he was doing. And he actually asked me if I knew what was cancer. And I remember that I said like, no, I don't even have a clue.
Of course.
And I remember that he asked me to close my eyes and to imagine that my body was full of little balloons of colors, all the colors that I really like. And that imagine that all those balloons were kind of dancing at the same rhythm, like I could choose the rhythm, maybe my favorite song. And that some of those balloons, they just because it started to dance at a different rhythm. And that those balloons were the ones that were called cancer and were kind of causing, were causing me to feel ill. But as those balloons were part of myself, I could talk to them and tell them to start dancing again at the same rhythm of the others. And I remember that since then, I started always to send like positive message to my body. And my mom, she used to promote that. I need to say that my family always have been very optimistic and positive, and being like that, I need to say that now also that I support people helped me to be able to surpass those days like easily. It's not easy,
Yeah,
you
I'm
know.
sure it's not. I'm sure it's not.
And well, after I got better, I just got out of the hospital, and the treatment continued for about a year. And I used to remember to visit the doctors and just get like the little medicine. Still, I had the catheterism after I left the hospital. Like for a year, the treatment continued, and I remember that it was my 9th birthday, and I still was like with the treatment. So I got better like in a year and a half. And I continue high school. My high school, no, it's like school, because I always wanted to continue school. So I remember that they did like homeschooling.
Right.
For me to be able to continue with my friends. For me, it was quite important to continue with my friends, because also like I know now that the teachers kind of explained to them what I was going on, you know.
Right.
So they didn't ask like funny questions, or they were not
anything that would make you uncomfortable.
But I remember that the other girls at school, they were quite mean. I remember some of them like saying, "We need to run apart from Julia because she's the monster." So it was hard, but well, I remember that I
above all that. So that's what is important.
And I need to say that maybe that's why like blocked me to talk about cancer. When I was young, I never used to like to talk about this. Maybe because I was I know now that I was ashamed. And I always asked this question when I was younger, and now that I follow this journey, this recovery journey with people, I know that the question why me, it's quite common.
Yeah.
And I used to ask this question a lot, even when I was like diagnosed on a second time. That time I was 14 years old. And I got it, when I was 14 years old, because why I understood why I always had kind of a close follow-up with doctors. During those years, I always used to have like 2 cancer tests, but I understood also that cancer have a remission time. Back then I was not aware. The second time I was aware that I was going to have a 5 years remission time before before doctors could say that I was healed. And well, the second time I was older, and I need to say that time I completely fell apart. I fell into depression. And the thing is that I am originally from Venezuela. And in Venezuela, that treatment couldn't be done because the doctor said this time she needs a bone marrow transplant. So, and because of the type of insurance that my mom got from her work, they could transfer me to a clinic in Houston, Texas. So I was treated in Houston, Texas, the second time at the Texas Children's Hospital. And the group of doctors there was also quite professional. But I need to say that something that I got to feel the difference is that the first group of doctors in Venezuela, they promoted for me to be to have a psychologist during all the treatment and after the treatment. And the group in Houston, Texas, they were quite professional, but they didn't put me, by hand of somebody that could like supported me in terms of my mental health
and emotional health.
And emotional health. And I need to say that the lack of that might be the case of me falling too hard into depression.
Right, right.
I turned 15 years old during that treatment. I stayed in the US for about a year, like 11 months. The treatment just, the doctors at the beginning, they said that it was going to be 3 months, but it took much longer. I was quite desperate. Again, because I was apart from my family, it was only me and my mom. I felt very lonely. And I know that now that I know how you go through a grief process during those moments, I know that grieving was quite hard, because during those health events, you lose a lot of things. You lose your liberty, you lose your clarity, you lose your physical, how do you say?
Fitness.
Your
That feeling of health, that feeling of being healthy.
vitality, feeling vital, you know, even the will to live, you know. I need to say that always I have been a very optimistic person, but during that time, I really even wanted to die some days.
So, so during these times when everything seemed to fall apart, so what kept you going during those times, and especially at such a young age? At 15 years old is we're just a kid at that time. So what kept you going? Your mother, the support from her?
My for sure, my mom's support was something that played a role, a very important role, but kind of keep doing all the things that I loved. For example, as I mentioned, for me to continue high school, to continue high school was always something quite important. I always loved something that I always loved to study. I always loved to. I always used to like achieve high grades and things like that. So I wanted the recognition to keep happening, you know. And
so that gave you an aim.
That gave me energy. So kind of my mom and my dad, they were quite proactive, and they asked to transfer like the program that was done in Venezuela to US. So I did also like homeschooling. Also for me to do jewelry, to do like hand things, you know, like creative things with my hands. I am quite creative, so to be able to continue doing like those little things, you know, during the times that I had some energy, to be able to continue, and I understand now, and I promote that even with the people that I am supporting, like continue doing the things that makes you feel that you are alive.
Right.
To paint, I used to paint a lot, and those type of things that makes you feel like motivated, you know, that give you a little bit of a spark. And also after I asked, they put me by hand with a psychiatrist, but I didn't like her, so I did not continue. And I remember that also I was, and at that time kind of the internet was starting to be a thing. And I remember to be able to be in contact with my friends, with some of my friends, not all of them, because I need to say that, and now I get it, you know, not everybody will be with you, will walk that journey with you. And there is something that there is kind of a barrier for people to be able to be there because they don't know how to be there. So that's why what you are doing, I found that it's quite needed, you know, because you are teaching people, you know, and you are guiding people during that time what things they need to do, you know, what other things apart from just being at the doctor, maybe, you know, changing your diet, and maybe tips that you need maybe to hear from friends, but they don't know, apart from the fact that they might be nutritionists or something. They don't need how to talk to you, or maybe specifically what a cancer patient needs. So to be kind of to treat patients in a holistic way.
Right.
You know, like taking care of body, mind, and even the spirit, you know, and the emotions. It was quite important for me. So like I call it like those were the rocks. My family stay, you know, in touch with some of my friends, keep studying, and even I need to say that it hasn't been easy, because for me to follow up with cancer, because when you are a kid, I know now that there is a high risk that you have like secondary illnesses caused by cancer, and that is my case. And so from the second time, as I had also chemotherapy, radiotherapy, but that time I had like full body radiotherapy.
Right.
And that really caused a damage in my ovaries. So one of the secondary illnesses that I got was like premature ovarian failure, which causes like premature menopause. So for me that process was quite difficult as well. But well, also I had like eye cataracts, but those were caused because of the bone marrow transplant that I had. It was from a non-related donor. I received high dosage of steroids, so for a long term, and at the very end also those caused like secondary illnesses. And because of that I got the cataracts. And later on I got osteoarthritis. And at the very end I need to say that apart from those illnesses I am doing very well. You know, I feel healthy, I feel vital, and I think that a lot now that I have that I have learned how to support people, and that I have prepared myself, and I have learned a lot about neuroscience, and I have learned about how you can be your own placebo, you know, how you manage those secondary illnesses at the very end, and the perspective that you have from life will determine also how you live.
So please continue.
No, well, what I was mentioning is like, apart from the fact that I get to recognize that I have been diagnosed with those illnesses, I don't feel that I have followed the prognosis that the doctors have told me that I was going to struggle with. For example, when the osteoarthritis, it was diagnosed in 2018. And actually during that time is when I kind of I started to talk about cancer, because I thought that all that past was kind of forgiven and gone. But during that diagnose, you know, all the memories from the cancer time were kind of revived, and now I understand that that was kind of trauma, you know. It kind of revived all those memories in nightmares, you know, and just like in vivid memories like that I just started like to be like shocked with it. It was quite shocking, I need to say.
How did you overcome, you're saying that you got nightmares, so how did you deal with that?
It was quite difficult for me, but I need to be also very I am very grateful. At that time I was living in Holland, in Amsterdam, and since there they have all doctors, apart from the fact that they work in different clinics, everything is centralized in terms of your medical history. So when I went to visit my GP, my general practitioner, you know, I explained my history, and I think that she called the doctor, and right away he explained that the damage because of their osteoarthritis, the pain at that moment was quite strong in my shoulders. And what I mentioned some minutes ago about following the prognosis is that they said like in 5 years I will be having like shoulder replacement in both arms. That made me fall again into depression, because for me, I was at that time working. I love my work. I use something that I recognize. I use my work to cover all the feelings that I needed to confront. I was kind of in a denial phase. But finally, well, when the pain was unbearable, I needed to accept that I needed to just accept that I needed to change my lifestyle. So I have changed a lot of things, my diet,
I was coming to that. So
okay, but maybe what the doctor actually did, the GP, because she connected with the doctor, she put me by hand with a psychologist. And I need to say that she saved me. And I also work with a wellness coach, and with both of them, because with her, with the psychologist, I was kind of working up the things that started like to revive about my past. With the wellness coach that I started a little bit like 3 or 4 months after I started work with her, I was like kind of understanding the things that I needed to change in my life to be able to regain energy, to feeling better, to understand better what was happening, and kind of in compartments, like starting to, based on the wellness areas that I needed to work in, how to prioritize and, start. Because I felt like kind of stuck, I was like, in terms of I had a treatment, to improve how I was feeling in terms of with the pain and mentally, and I had to resign my work, and in my work they were not very supportive, because they were not like, how do you have osteoarthritis if you are still like 34 years old? So there is also kind of a cultural
stigma attached to it.
Totally. And there was a lot of I felt like miscomprehend. And I think that also like made me fall again into depression, and I was diagnosed with severe depression. I got into anxiolytics, and also for some time again, because on the first time I also got like some medicine like to manage my feelings. But for this time they said, now that you are having these memories, we don't want you to be too much time in this medicine, like a lot, because you need to allow those feelings. And they actually only kept me in anxiolytics because I started to have like panic attacks, a lot of panic attacks. The first one, I felt that I was having like a heart attack, and then they explained that I was having a panic attack. That was a panic attack. But I just ran to the doctor because I said, I think there is something wrong with my heart. But so I just work with both of them, with the psychologist and the wellness coach, to be able to go through the recovery phase.
So did you also try some complementary treatments as well, some alternative treatment?
Yes, I tried. I am open to try whatever they say that can help. I need to say that I learned that since I was very young. My mom, she was always like quite proactive to try like food and things that people might say that it can help, like eating healthier. I need to say that since I am very young, I eat very healthy, I think that was one of the things that my family was quite proactive. Like I always ate like things like to promote blood red cells and like red food and a lot of veggies, and they always took care of me. And I think that I just like took that type of lifestyle into my personal life when I grew up and apart from my family.
This was basically just diet that you focused on. You maintained a healthy diet. right from the very beginning.
Yes, and also, for example, I always took care because the doctors always kind of said to me since I was very young, like, you can smoke, you can drink very much, and but they were like sometimes quite hard, and I was like, I used to smoke because actually I used to work in a tobacco company.
Right.
But I just did it like socially. I am honest. I am being completely honest. But then I remember that I went to a doctor because I had like hormonal replacement treatment since I was young, and I just said like, well, yes, and she gave me such a hard, how do you say? Had hard talk, about you not do it, and I was okay, I will not do. And I need to say that also during the second time that I also try a lot of new things. I try acupuncture.
Right.
That helped me with the pain and with my mind a lot. I need to say that acupuncture 100% recommended in terms of how it helped me. Also Reiki. I have tried Reiki. I also, for me, like to Reiki.
So did it help you? Like how did it help you? How, to what extent did it help you?
The thing is that for me, it always, when I have been trying, because this is not the first time that people ask me how did I recover, but when I try like to explain to what extent, I need to say that it was kind of a combo.
Of everything. It's not just one thing.
Not just one thing. Also, for example, since 2018, because of my husband's recommendation, after he heard a podcast and then we spoke with this lady, I started. I do in Espanol. I do intermittent fasting.
Okay.
So I only have I only eat during a window of time during the day, because they said that will help regeneration, tissue regeneration, and maybe even not bone regeneration, but it can help, And also I stopped eating red meat since 12 years ago. I don't eat red meat. I eat meat. I eat fish meat and poultry, but I don't eat red meat. And I also reduce a lot since then, like cow milk, because in our culture we cow milk, and now I do coconut milk or almond milk. So that's why I was mentioning, it has been like a combo thing, because since then I started to say what things I can do to feel better. So I was with the psychologist, I was with the wellness coach. I also did a body cleanse 3 times, eating veggies only for 1 month before doing these 3 cleanses that I did, and that helped. And I need to say that the first one that I did, because it was also with, I am going completely honest, and I don't mind if you show.
It's good. It would help. It would surely help other people.
I did a cleanse, and it was also with I think that the right name also in English is edema. And I need to say that the first time, this was a follow-up by the wellness coach, and I believe that I smell chemicals, because she said, now that you have been like telling me everything, your history, there are some chemicals that even after years the body is not able, by itself to be able to release. So with these 3 cleanses, the idea is that we help the body to release those, because as those were actually the main cause of the osteoarthritis, they might hurt you even more if they stay in your body. I actually believe that it helped, because as I mentioned, I don't follow the prognosis. I don't have the pain that the doctors said that I should have. I don't have really pain for the damage that they said that I have, and I have the radiographies and everything. And I also, since then, I always said I always need to say that also it has been a savior. I started meditating. And meditation for me has also been kind of a tool that I have used to be able also to induce healing meditations. I read a book, and I have been reading reading a lot of books of psychoneuroimmunology and how it works in your body, and involves a lot of meditation. And I follow Dr. Joe Dispenza and Marianela Castes, and there is another doctor, I don't remember the name. I have read some of their books, and how positive thoughts, optimistic thoughts work in you. And I have also recorded myself to do like meditation healings with my voice. I need to say that it has been a combination of psychologists, the wellness coach, changing, improving even more my healing habits, the intermittent fasting, doing the acupuncture. For sure, none of those I have been able to do those at the same time, but since 2018, I have been trying different things. I also, for example, recently I also tried Sun energies. I don't remember. It's kind of a different type of Reiki. So I always keep trying things that I know that can improve my health. And
Okay. So, what would be your message to other cancer patients and to their caregivers, their parents? So, what would be your message to them?
I think that first, to the caregivers, I need to say that is to be patient with the patient, because I know that it might be hard to be with them at this time, because there is a lot of maybe rage, a lot of pain, a lot of guiltiness coming from this person. But just being there for them, it's important. And sometimes just echo, what they are saying. Not trying like to say that it's going to be better, that it's going to pass. Just do an echo, because during that time, one of the things that I get to recognize, even with the people that I am supporting, is that you just need to hear them.
They need that at that point of time.
Yeah, because at that point, you are just processing what is happening, and what is happening also, it's causing you a lot of pain. It's causing you to feel a lot of, like difficult feelings, There is not good or bad feelings for me, but you are going through difficult things that are hard to process, to understand. And also that in terms of I don't know how it is in your culture, but in my culture, for example, it is not good if you feel rage, if you feel depressed, and they make you feel like the stigma that how can you say, for me, people sometimes, I know that I make people feel awkward, when I speak so openly about what happened to me. But I think that I would like to break the taboo that talking about it, it's wrong. No, talking about it, it's right. It's needed. And just for the patient, I just need to say that asking for help and accepting the support, and just understand that apart from the fact that it's hard, nothing is permanent. And that maybe this is not what you want to hear, but this will pass. And I think that one of the most important things is like always keep your mind with that idea that you are going to heal. And keep in mind what you want to do when you heal, because with that goal in mind, it will make the journey easily, and it will inspire you, apart from the fact that it's hard. Will keep you going, because you have something to live.
You're absolutely right.
Yeah.
So, lastly, if you have to sum up your journey in just one sentence, I know it would be difficult, but what would that be?
For me, I need to say that my journey, not my journey, understanding what happened, giving me validation, that happened, that was my reality. It was hard. It was not good to experience. Just allowed me to heal apart from and to heal and to feel vital apart from the fact that I might have sequels from that illness. So it's just like giving you the opportunity to learn from it, how you change your mind and stop being ashamed, stop feeling guiltiness, and stop just to accept that it's a thing that might happen to anybody.
Yeah. So it's been really inspiring listening to you, Julia. And thank you very much for sharing your experiences with us. And I wish you all the very best for all your endeavors, all your future endeavors. And thank you very much. Take care of yourself. Thank you.
No, thank you, Rohi. A pleasure, and wish you well.